Okay.
Well, we're here with Dr. Pittaw. Dr. Pittaw, let me ask you, you're a dentist. Are you doing orthodontic work in your office or braces?
Well, Helmut, that's a good question. My father was an orthodontist, and my associate is doing some Invisalign, which is the invisible braces. Right now, I'm doing only minor tooth movement and very limited orthodontics. I have some great specialists that I refer to in the area.
Okay. So when you say your associate, is that somebody who works in your office?
Yes. My brother, Dr. John Pittaw, he practiced in Honolulu for 22 years, and we have him working with us in the office now. And he is doing some Invisalign. I haven't taken that course yet, but I plan on it.
Okay, but so in your office, Invisalign, which is, for all purpose, the newest way of doing orthodontic work, is performed, right?
Yeah, it's very convenient for many people who don't want to have the wires. It's a nice way to complement treatment when we're doing cosmetic dentistry. But it lacks the control that you need for complicated tooth movement. Sometimes it's better to have the regular wires, and you can get more accurate tooth positioning.
Okay, so give us the rundown of when an Invisalign and for whom an Invisalign would be good, and how it works versus the traditional wires and braces.
Well, Invisalign is actually a very high technology product. They have virtual models they create, and they can move the teeth virtually, but every step along the way they create models and retainers that will help push the tooth a little bit further each time. And so you have a set of retainers made that you can take home and not worry about going to the dentist. You wear one retainer for a little while, then you wear the next one, then you wear the next one, and then you come in for a check once in a while. And we can even track the case online. It's really cool. Traditional bases require a little more maintenance and are definitely useful for more complicated cases. You can't do every kind of tooth movement with the Invisalign, but we can sure let you know what would work best.
Exactly. So when you say a retainer, basically that's kind of like a mouth guard which is made out, for all purpose, let's call it plastic. It may be something different, which gets put on the mouth, and it basically is made a little different than your teeth are currently, so that it then straightens them out. You know, it pushes them into the right position slowly, and each retainer or each mouth guard is just a little bit more straight and more straight and more straight. Is that how it works?
Yes, that's right. Each one moves you closer towards the final result that we predicted. And it's very easy. They're clear, they're lightweight, they're comfortable. You feel a slight pressure on the teeth, which you're supposed to. And sometimes, along with the Invisalign retainers, we have to do something called IPR, where we thin out the teeth that are a little too wide, that won't fit in spaces sometimes, and that helps everything fall into place.
Wonderful. Now, question. They're called Invisalign. Are they really invisible?
Well, you know, they are pretty darn invisible. You can tell if you look close, of course, but they're thin, lightweight, clear. People can talk with them, talk on the phone. If I was wearing one now, you wouldn't be able to tell on a webcam.
Okay.
But I'm not wearing one.
Okay. All right.
But I'm going to get one.
So they are rather invisible, and many other people have told me so. Now, also, there seems to be the advantage that while you eat, you take them out, thus you can afterwards floss and brush your teeth very nicely the way you would normally do, which if you have braces, you really can't do that. And not flossing and brushing correctly is a big problem while doing orthodontal work. Is that with normal braces? Is that correct?
Well, sure, Helmut. That's correct with the braces. It's hard to do the extra work and take the extra time to keep the teeth clean enough. It's much easier when the braces come right off. It's much easier, yes.
Right. So that means a person can maybe avoid a potential gum disease problem, which in itself, we have talked about gum disease, how devastating that is, how to have an infection in your mouth, that potential...
Well, sure, the gum disease and the white spots on the teeth that happen frequently with braces, they leave marks on the teeth. So actually, with the Invisalign, you can put a gel that we have. It's a non-abrasive toothpaste with a high pH. You can put it right in your trays and put it on your teeth, and actually is therapeutic. So it's really helpful.
Wow, great. So, and if a person is very, very conscious in terms of the braces being seen on that job interview, on that first date, he or she could take them off for that hour or for that interview, which of course with normal braces you simply cannot do.
No. I mean, if you need complicated tooth movement that requires real braces and you don't want them to show, they can actually place them on the backs of your teeth. Now, that might turn your tongue into hamburger, but they won't be seen very well. They might affect your speech. I remember a case I saw that was Miss World had her teeth done, and they had to put braces on the inside of her mouth so that she could continue to be Miss World and do her interviews and her advertising and meetings.